were funded many times by various donors. And what we did, we empowered our clients with assisting their business to continue. And we improved their knowledge and skills. But after the donor came to an end, we went bankrupt as an organization. We stayed for 1 year without implementing our activities and objectives. But we came up as a management and said, we need a way where we will have continuity and sustainability as an organization. So what we came up with was to get funds so that we start income generating activities. And by good luck, we found BEPFA, which funded us, and we started a dairy project. And so far we have 2 dairy cows on the farm, and we are having milk that we are selling, and now we are able to maintain our staff, and we are able to continue with the program. So we are indeed grateful. That's why we are here to say that we need sustainability of our organization. So we are looking forward for where we can continue having resources and income to continue as an organization. And if we didn't do that, we could be still back to the same position where we could not assist other people. Thank you.
As part of the summarized solutions to the problems we have as NGOs, we've come up with several points. We all agree that most of our NGOs have some kind of speciality one way or the other. So that means at the end of the day you have an expertise in that particular field. Most of the NGOs invest in a lot of training for their staff. So the staff become like consultants in that particular field. And we need to leverage on that. So we can be able to sell our expertise in terms of consultancy and in training as NGOs. So at least we can be able to create some source of income, even as we are doing whatever else we are doing. And even as we are collecting our data as an NGO, after we've done whatever is bare minimum from the government, using the normal national tools. At times, as NGOs, we have specific projects or specific kind of data that we collect, which you can be able to package and somehow share with other organizations that we may be interested in, or companies in terms of penetration to the market. And that way we can also be able to gain monetarily from that. NGOs are also, most of the NGOs are also well connected with the community. So we can leverage on that, because already we have a way of mobilizing in the community at the community level. And introduce corporate and other business people into the areas that you are working. And that could also mean you are part and parcel of whatever is happening in that particular area. And of course, in cost sharing and ownership, when you do that, by could be allowing the beneficiaries to distribute part of the, or to contribute to part of the issues that you are dealing with in the community, the project you're dealing with. So I understand time is almost on our, not on our side, so I'll just go through. The other part is like independent rating agencies for the NGOs, where you can leverage on that, and if your organization is performing well, you can use that to, for further fundraising by referring people to that rating agency to see how you performed. And of course, the incubation for NGOs, like a place like this where we are today. Instead of just going to an office, a big office space, you can try to co-share several NGOs in one particular place as they are growing. Of course, having a very nice way of telling your story, your success stories. Thank you.
The first one is to get business and entrepreneurs working together more with NGOs so that NGOs can keep in mind how do businesses work. I've spoken to Mr. Stephen over there where he saw some of his aid money pulled away. How do we work with Stephen as business, as entrepreneurs to show him that we can think business-minded too as NGOs so that we can become self-sustainable? Point two, to challenge donors to also think differently. So currently, donors work in a very specific way. How do we say, yes, my business has a social element to it, but it can be for profit too, and I can become self-sustainable with the right capital? Last thing, to utilize our social networks. So if you think about all the NGOs that work together here and the amount of information you collectively have as a group, how do we all benefit of it and use it to work more effectively? Thanks.
We are trying to reduce stigma and discriminatory practices against the marginalized groups in order to enhance uptake of health services amongst the groups and also to encourage recognition of human rights. Who are these marginalized groups? We say people with disability, people living with HIV and AIDS, and the most at-risk population. Then we moved further to orphans and vulnerable children as the other audience, and lesbians, gays, bisexual, transgender, and intersex. Now, these marginalized groups are largely excluded or discriminated against by the virtue of their orientation, that is physical, health, and social status. For example, most of the healthcare providers are not trained to deal with people with disability, e.g., deaf patients get it difficult to interact with health officers or clinicians who are providing services because of the sign language. Then people living with HIV are still secluded or discriminated against in the community, and some are not even given opportunity in the process of decision making in their communities. We also talked about creating a platform for the marginalized groups to share their experiences, challenges, and stories, effectively giving these users a space to voice out their opinions and grievances so as to highlight their plight in the quest for access to health. So what we proposed in terms of technology is that we were referring to the Kenya situation, that we can come up with a platform such as the USAID platform, which will enable a two-way conversation so as we can send in the opinions, sentiments, and share experiences using SMS, email, Twitter, and even Facebook. Now, in terms of existing solution, we tried to ransack ourselves, but we realized at the moment, not much. There's no any other person trying to get a solution. Then we came up with a follow-up plan. Create crowdsourcing platform. We're proposing that USAID can be a leader agency. Then we are talking about structuring the data through NGOs, CBOs, civil society organizations, and even the government, and also develop a resource envelope so that we can really move on with the plan and also involve partners and stakeholders through the social network. Thank you.
Our summary problem was, in the developing countries, the leading causes of mortality are malaria and HIV-related illness among children and adolescents. The young people between 15 and 49 years are most affected. These are children in the secondary schools, colleges, early employment, the informal sector, farming communities, and entering employment. These are the energetic, idealistic, and economically active group of our people. Lives cut down at their most vulnerable prime. A new discovery is that adolescents living with HIV are mostly affected because of drug holiday, which is a scenario where they feel they should pause their ARV medication. for some time. This is like the adolescents that have taken ARVs since they were young for a long time. When they reach 12 to 15 years old, they want to take a break. It just comes, they want to take a break, and from that we lose a lot of them. They die or they move to second line to that which is not so much available in Kenya. So it's a big challenge, and we lose a lot of children through that. And the summary of the proposed solution was organizing advocacy forums to engage the policymakers, donors, and the community at large. And we were looking at that, we looked at bringing everybody on board, from the people who make policies that will change their lives, the people who have the problem, and all the community that work with them to help them. So when we bring everybody on board, we'll get the solution to the problem that we are facing. The technology to solve the problem was sending short messages to target groups using social networks such as Facebook, Twitter, Ushahidi Network, which was a form of the crowdsourcing network that you are using. Using the local radio stations, editions, and magazines to reach people from the grassroots levels. The existing solution or relevant risks are engage mobile companies, data bank that had previously worked in areas of research and promotions. The organizations that are working in those areas, the researchers like CDC Cambridge and everybody that have previously worked on them, we get their data and then we use them. Create links with the target groups, the relevant thematic areas. Follow-on action, we talked about organizing annual festival with the target group, set up platforms and sensitize the intended audiences, engage policy makers extensively. Thank you.